Hello, my name is Sudhir Tikaram. I hope you're well. Today I'm going to be doing a mini demo on mixing insulin and based on the sliding scales, of course, and how to administer insulin subcutaneously for a patient. So first of all, I'm going to be starting off by checking the doctor's order for treatment for completeness. And I'm going to be cross-referring the information with the MAR, Medication Administration Record. I'm going to be checking patient's name on both, which is Elizabeth Khan. I'm going to be checking the medication names, the dosages, the routes, and the timing of when the medication is supposed to be given. So the first medication I'm going to be checking is the Humulin NPH. Humulin NPH on both is the same name. 22 units to be given for Elizabeth Khan and to be given subcutaneously daily, 8 o'clock in the morning. And the reason is because the patient has type 2 diabetes. The second medication I'm going to be checking is for Humulin R. Both have the same name for Elizabeth Khan, and this Humulin R is going to be given based on the patient's blood sugar, which is 14.2 millimoles per liter. It's going to be given based on the sliding scale, and because this reading it falls between 13.1 and 17 millimoles per liter, we're going to be giving Humulin R as 4 units for the patient. Elizabeth Khan, we're going to be giving it subcutaneously. We're going to be giving it 8 o'clock in the morning. It is supposed to be given TID 3 times a day before meals. And the reason is because the patient is type 2 diabetic. Now, we're going to be checking the MAR for patient allergies. It says penicillin. Patient is allergic for penicillin. And neither one of these medications is expired. Both have current expiry dates. Okay, so now I'm going to be doing hand hygiene, and I'm going to be rolling the Humulin NPH to mix the solution inside. Okay, so the solution is mixed, you can see now. And now I'm going to be cleaning the tip of both the medications with alcohol swab in a circular motion. Also for Humulin regular, doing the same thing, cleaning the tip with alcohol wipe in a circular motion. Now, after I've done that, I'm going to be performing the second check. I'm going to be checking patient name, cross-referring the information from MAR on the medications. I'm going to be checking patient's name, medication names, dosage, time, route, and reason. So for the first medication, which is Humulin regular, it's for Elizabeth Khan, and 4 units to be given subcutaneously, 8 o'clock in the morning, to be given TID 3 times a day before meals. And the reason is because the patient has type 2 diabetes. We're doing for Humulin NPH, the same thing for Elizabeth Khan. The dosage is 22 units to be given subcutaneously, to be given daily at 8 o'clock in the morning. And it is because the patient has type 2 diabetes, that's the reason. Okay. Now what I'm going to do is I'm going to be using this syringe, which is the 1 milliliter 29 gauge syringe. It has units as measurement system. Sorry, the safety broke on this one. I apologize for that. And I'm going to be drawing 22 units of air in it, and I'm going to be injecting that 22 units of air in the Humulin NPH. Okay. So the Humulin NPH, I'm going to be putting 22 units of air in that. So first I'm going to make sure this one, there's nothing in here. I'm going to press it all the way up. Okay, 22 units is okay. 20. Okay, so that's 22 units. I don't know if you can see. Yeah, 22 units. I'm going to be injecting it in the humulin NPH. As you can see, like this, so that I don't contaminate the plunger. The needle is bent. Okay, here you go. Now I'm going to be drawing 4 units of air in this syringe, 4 units. That's 4 units. And I'm going to be putting that air in the humulin R. Okay, there it is. Okay, now I'm going to be drawing 4 units of humulin R in this first. Okay. Okay, making sure there are no bubbles. So that's 4 units of humulin R. And now I'm going to be drawing 22 units of humulin NPH. So like this. The needle is bent. Just trying to put it in. So 22 units of humulin NPH. So it's going to come down to a total of 26 units because 4 plus 22 is 26. Okay. Okay. "26 units. 26. Making sure there's no bubbles here. And now I'm going to be putting the cap on. So the cap is on. And now I'm going to be making sure that I go towards the patient's bedside and I check the patient's name and date of birth based on the bracelet of the patient and cross-refer it with the MAR. So the patient's 2 pieces of identification is name, Khan is Elizabeth Khan, and date of birth is August 8, 1954, cross-referring it with the bracelet. And I'm going to be performing another check on the patient's bedside now. I'm going to be checking the patient's name. And this patient's name will be checked with the label on the syringe that I have put, the label. And so the label is the patient's name is Elizabeth Khan. We're going to be checking the drugs names, which is for humulin NPH and humulin R, 22 units of humulin NPH and 4 units of humulin R, both to be given subcutaneously. Humulin R to be given 3 times a day before meals, and humulin NPH to be given once a day, 8 o'clock in the morning. Both are given because of type 2 diabetes, and the reason is type 2 diabetes. I'm going to be informing the patient about the right to refuse, just in case the patient wants to refuse. He's going to be informed about that. I'm also going to be educating the patient using the right to education by informing the patient about any sort of side effects of needle injection. It can cause mild rash, mild pain on the site, and I'm going to be telling the patient about the duration of the insulins, how long it takes for each insulin to act, basically, and just educate the patient. So now I'm going to be asking the patient where the last time he was given the insulin. So based on that information, I'm going to check it with the MAR, and I'm not going to use the same site again. I'm going to be palpating 2 inches towards the right of the umbilical to make sure that area is okay. It's not red. There's no redness. There's no bruising. There's no lumps or bumps there, and the palpation inspection I'll do. Okay, once that is done, I'm going to be doing hand hygiene. I'm going to wear my gloves, and with the alcohol swab, I'm going to be cleaning that area in a circular motion. Now, I'm going to be taking the labeled syringe, take the cap off, and I'm going to be making sure that I squeeze the area a little bit to get the fat up a little bit, and then inject the needle in a 45-degree angle, and then put in the medication, the whole 26 units. Once that is done, then I'll take the needle out and I'm going to throw it in the sharps container, which is right beside me. Once that has gone in the sharps container, I take the alcohol swab and I just press it gently. I'm not going to massage it or rub it. I'm going to press it gently for 60 seconds. And now, once that is done, I'm going to be asking the patient if he's okay, if he's feeling better or not. And then I'm going to be performing the right to evaluation and the right to documentation as well. So in the right to evaluation, I'm going to be mentioning in the progress notes well how good the patient's progress has been, what I noticed in the patient, and whether everything is going fine with the patient so far. Right to evaluation and right to documentation is basically going to be mentioning the date, time, and the medication dosage and the route of administration for the patient on the MAR, and that's going to be the right to documentation. And once that is done, I'm going to be cleaning up my area, going to be taking the gloves off, throwing it in the bin, and doing hand hygiene. And I'm going to be asking the patient if he needs anything else. If not, then I'll come back later. I will remind the patient that he has to eat within 15 to 30 minutes of the injection, because there is an intermediate and fast-acting insulins. So he has to eat within 15 to 30 minutes of being given the medication. Okay, it was nice doing this video. Have a nice day. Take care. Bye-bye.